I'm a researcher with the National Center on Homelessness Among Veterans and the Birmingham, Alabama VA Medical Center Health Services Research and Development Program. I'm also an assistant professor at the University of Alabama at Birmingham School of Public Health. So the first of those studies, we found that women veterans who've reported past year intimate partner violence have about 3 times the odds of experiencing housing instability compared with women veterans who haven't had those experiences. Women veterans are the fastest growing segment of the veteran population. They're much more, the population of women joining, participating in military service has grown over time. So the number of women veterans has also grown over time. The VA has traditionally been an institution that's focused on serving men because veterans are largely male, and women veterans have some unique needs, and particularly, the new women veterans who are coming in are younger, they have children, they have needs that maybe the VA hasn't traditionally needed to address. So we're sort of looking at a lot of issues around women veterans and this growing population of women veterans, but sort of after reviewing the literature, one sort of striking theme is this experience of trauma. So we wanted to explore that further. One major lesson from this research that I think will be helpful for veterans experiencing homelessness or who are at risk of homelessness is really from more the healthcare system. So the data that we use when we conduct this research are data from veterans' medical records. So these data exist. They're they're not collected as part of research. They're collected as part of veterans' healthcare experiences. So healthcare providers, social service providers in the VA setting have access to this information that can let them know, even if a veteran doesn't tell them that they may be at risk for homelessness, they know if there's an indicator of military sexual trauma, this veteran is at increased odds of experiencing housing instability. They know if there's an indicator of intimate partner violence in their medical record, they're at increased risk of housing instability. There's the potential to sort of, even without, directly discussing, are you having housing issues? You can know that these veterans may need you to talk about some of these issues. Research around trauma and housing instability among women veterans, I think there's a lot more to be done. I think that that's a small part of the research that needs to be done around women veterans. As I mentioned, we know very little about the other sort of life and social factors of women veterans generally and who are experiencing homelessness specifically. And there are often, as I mentioned earlier, there are likely specific needs around, caring for children. Women veterans, particularly those with children, homelessness may look different. They're often doubled up. They may not be identified as homeless. They may not be eligible for certain services because of sort of what their homelessness looks like. So I think, future research needs to really sort of understand the needs of women veterans around not just directly housing, but all these other issues that can impact housing, and to really think about how we can either create new interventions or sort of adapt some of the existing interventions that exist to really address the specific needs of that population. A lot of the studies that I work on, we feel very strongly about incorporating veterans' voices into this work. So we often, while we're using this administrative data, while we're looking at medical record data, we also like to interview veterans about their personal experiences. So when we conducted a study just to learn about VA's universal screen for housing instability. So all veterans who come in or ask questions about their current housing and sort of if they have any concerns about their future housing. We interviewed 60 veterans, 30 women, actually maybe 20 women, but we interviewed veterans about housing instability that we were asking. We asked these questions. What do you think these questions that we're asking in the healthcare system mean? What kind of resources do you need to access housing? And not even prompted at all, these women constantly, almost all of them brought up these issues of trauma of, you know, losing their housing because of an abusive partner, or experience of trauma during military service that sort of spiraled into, you know, having, like, leaving military service early. So then they're out of the military. They don't have maybe the benefits they would have had they stayed in longer, and how those experiences sort of, you know, over time impacted their housing. And so, you know, hearing these women's voices really sort of puts a face to these other data that we use. Like I said, really important to sort of move it from, you know, a chart or a table or a paper, you know, these sort of research products to like a real life experience that real people are having.